I have all the pregnancy symptoms, but whenever I run my pregnancy test, it says negative. Hey guys, welcome back to my channel. My name is Precious and I'm a registered nurse. Okay, so a lot of women complain that they have all the pregnancy symptoms like the sore breast, nausea, fatigue, breast tenderness, headache, and so on. All the pregnancy symptoms, right? But whenever they run their pregnancy test, it still says negative, and they're asking what could be the problem. Firstly, let's understand what happens in a woman's body. Okay, so during ovulation, after a woman have an unprotected sex with her partner, if the egg gets fertilized, it takes that egg about 6, 10, or 12 days for this egg to move from the fallopian tube down to the womb to get implanted. Okay, and it is just after this implantation must have occurred that your body starts producing the pregnancy hormones, which is called the human chorionic gonadotropin hormone, and this is the hormone that your pregnancy test strips look for, okay, to detect pregnancy. Now, since I said it takes 6, 10 to 12 days for the egg to move from the fallopian tube down to the uterus to be implanted, it is different for everybody. Okay, for some people this egg implants faster, while for others it might take a while. Okay, now if your egg implants day 10 post ovulation or day 12 post ovulation and you test around day 8 post ovulation, you will see that it will read negative. Reason is because the human chorionic gonadotropin hormone, which is called the HCG, is yet to produce. Okay, is yet to be produced, and even if it is produced, it will still be in a very low state. It has not increased. So this is one reason why a lot of women have this negative results, because the HCG is still very low. So that is why I advise most women to test for the positivity of their pregnancy maybe around day 12 past ovulation, or even the main day they'll be expecting their period. All right, so this is to avoid you thinking that you're pregnant meanwhile you're not pregnant, or you're pregnant and you're seeing negative and then you're discouraged or pained. Okay, so test a while after you're sure that this HCG, if implantation actually have occurred, that this HCG will be very high. To test for the positivity of your pregnancy, urine is usually used, and then blood too. Okay, but most times urine is used at first. Okay, so if you're going to use your urine to test for the positivity of your pregnancy, it is advised you use your early morning urine. Okay, don't wait till you've eaten a lot of things, taken a lot of fluid, drinking a lot of water, juice, soda, and every. By that time your urine concentration will be very low. By that time your urine is already diluted, it's no longer concentrated, and this HCG is mostly seen in a concentrated urine. So it is advised that when you wake up in the morning, use that first urine that you produce, or maybe few hours after waking up, before taking any fluid or any drink at all. All right, so if you test for your positivity after you've eaten a lot of things, you've taken a lot of fluid, you've taken a lot of juice, teas, you might end up getting a negative result even when you're positive. Believe it or not, okay, a faulty or an expired pregnancy test strip can be a reason why your positivity is showing negative. You know, it's easy to walk into a pharmacy to get a pregnancy test strip without looking out for the expiry date. Sometimes these things are expired and the owner still sells it in his or her pharmacy just so that they can make sales. So it's in order to prevent this, please, whenever you get your pregnancy test strip, look out for the expiry date. Okay, look out for the manufacturing date and the expiry date, because if you're using an expired test strip to test for the positivity of your pregnancy, it will definitely show negative, or it might show positive when you're not even pregnant. And also read the instruction at the back of the test strip. Follow the instruction on how to test for your pregnancy. All right, if you're told to leave the test strip in the urine for a couple of minutes, keep to it, and then after bringing that from the urine, a number of minutes to wait for it to read is still noted there. So watch out, read the instructions so that you can get the accurate reading. Hormonal imbalance or premenstrual syndrome is one reason why you might have the pregnancy symptoms and still test negative. Conditions like polycystic ovarian syndrome, fibroid, endometriosis, thyroid issues, even stress, and extreme stress can cause hormonal fluctuation that mimics pregnancy symptoms. So these things I listed can make your body to start producing pregnancy symptoms, making it look like you're pregnant, but you're not pregnant. It's just a hormonal issues. Even menstruation symptoms can mimic pregnancy. We all know that most times before you start menstruating, your body starts changing. All these are still hormonal fluctuation, because you notice that when you want to menstruate, your breast starts becoming tender. Some people notice they even get nauseous. Some people notice headache. Some people notice nausea. Some people notice weakness, and these are just part of what menstruation comes with, not actually pregnancy. But because they look alike, you might start thinking that you're pregnant. All right, so hormonal issues, stress, and other premenstrual symptoms can make your body mimic pregnancy. So this can be one reason why you're noticing that you're having these pregnancy symptoms, yet your test results says negative. There's something called psychological or phantom pregnancy, though it happens in rare cases. Okay, most times when a woman starts craving to have a child, like a woman's desire to have her baby is high, psychologically her brain starts thinking that she's pregnant. Her brain can trick her body into producing pregnancy like symptoms. Okay, so now when your desire to have a child is so high, you want to have your baby, you start noticing that, I don't know if a lot of women are in that position, you start noticing that your body starts thinking, your brain starts making your body think that I'm pregnant. You start noticing those signs and symptoms that come with pregnancy. It might happen almost every month for you, and then you're worried, what's happening? I thought I was feeling pregnant, I thought I'm seeing these signs, what's happening? It's just the brain thing, it's a phantom thing. Okay, it's a phantom thing. Is your brain tricking your body to produce pregnancy like symptoms? It's not your fault, it's what your heart desires, and that is one reason why you might test negative even after having pregnancy symptoms. Some medications or health conditions is one reason why you might have pregnancy symptoms yet test negative. Certain fertility medications or hormonal treatment medication have the tendency to temporarily cause your body to produce similar pregnancy symptoms. Okay, so some medications some women take for fertility, okay, some drugs that you're being prescribed to take, maybe you're having fertility issue or you're having a hormonal issue and you're giving these medications to take, sometimes they can make your body to start even producing something that looks like HCG, and then you start feeling these pregnancy symptoms. Meanwhile, you're not pregnant. Okay, so if you're undergoing any fertility treatment or hormonal treatment and you're observing that it seems I'm pregnant because you're noticing some signs, it could be that it's because of those drugs, okay, or those treatments plan that you're undergoing. So what should you do if you're noticing all this? Number one is to wait for some time before you test for the positivity of your pregnancy. All right, so wait for like a date or your main ovulation day to test for your pregnancy. Number two is that if you waited for your period to come and it's not coming, and then you've tested with urine for the positivity of your pregnancy and it is still saying negative, and a week has passed yet no period, the test strip is still saying negative, please rush back to your doctor, your O&G, or your midwife. Okay, a blood test can be done just so that in case your urine is not picking up the HCG, maybe your blood test can pick it up. Okay, at least you can confidently know your state of health if you're pregnant or maybe you're having an underlying health condition. Number three is keep track of your cycle. If you haven't watched my video on how to calculate your cycle length, your fertile and your safe days, I have a video on that. Okay, so you can go back and check it out and watch it. You have to know your cycle length, you have to know how to track your ovulation and your fertile period, so that you will know when to go in and have an unprotected intercourse with your partner. Okay, take good care of yourself. You can't be wanting to get pregnant and your body is not prepared for pregnancy. I don't think your baby will want to live in a body that is not prepared. So eat well, eat good food, eat healthy meals, take enough fluid, hydrate yourself, especially with water, eat fruits, enough fruits and vegetables, leave junk. Okay, avoid junk, avoid food that are not in any way beneficial to your health. Okay, and then most importantly, be hopeful, have a positive mind. Okay, be hopeful, be optimistic, think positive, and who knows, your faith to carry you through. All right, and please do not blame yourself. Your body just works differently. Every woman out there is different. Some women try once, twice and they are pregnant. Some, it doesn't work that way. It still doesn't change the fact that you will get pregnant. yours might just take a little while to get pregnant. All right, if you've had these pregnancy symptoms and yet your test result is still saying negative, please, you could kindly drop it in the comment section. All right, thank you for watching today's video. Please like, subscribe, share this video out there, and then I'll see you in my next one. Bye.